Now, the cruise ship on which 3 people have died of hantavirus is preparing to set sail for the Canary Islands, where all on board will be medically examined and cared for before being transferred to their home countries. This is the ship. This is the live shot we have of the Dutch-flagged MV Hondius. It's anchored just off Cape Verde. And before it can continue its journey, 2 seriously ill crew members are expected to be taken off the ship and flown to the Netherlands for treatment.
After days of going nowhere, the MV Hondius appears to be heading for a safe harbour. Cape Verde said it didn't have the medical facilities to deal with the outbreak, so the World Health Organization asked Spain to help. The passage to the Canary Islands will take 3 to 4 days. The Spanish Health Ministry said Spain has a moral and legal obligation to assist these people, among whom are several Spanish citizens. But in a post-COVID world, not everyone is comfortable that an infected ship could be on the way.
I'm not very happy about it, not really in favour, but we have to look after them.
I don't think it's right for them to dock here because it's a disease that can be transmitted between humans.
They have to dock somewhere. If there are controls in place and transmission isn't allowed, then fine. They have to dock somewhere.
First, medics who've been on board will have to decide if 2 infected crew members need to be taken to shore. One is the ship's doctor. Passengers like Kassem have been documenting the emergency on social media.
What they have done so far is send their own doctors who took samples from the patients on board, but so far they have not come out with a result or a decision.
Epidemiologists are now scrutinising this outbreak closely. Hantavirus begins like flu, but can then develop into severe lung disease, with a 30 to 40% chance of death. The incubation period can be up to 8 weeks, making it harder to track. One theory is that this is a strain which originated in the Andes and is transmitted by rats. Given recent history, experts need to make sure there is no risk of an epidemic.
Clearly, we need to know how this infection got on board the ship, whether indeed it has spread person to person, and if so, whether this has indication for anything in the future. And at the moment, we don't know the answer to those questions.
When the passengers are finally allowed to disembark, it's likely they will still face quarantine and more medical monitoring. Their long, difficult journey continues. Tom Simons, BBC News.
The BBC's Pumsa Fihlani has been speaking to some of the people on board.
We are getting views from passengers who tell us about how frustrated they are about the situation they find themselves in, mostly because of that line that's come out from the WHO that there is now a confirmed risk of human-to-human infection, and that's made a lot of people there nervous. And they've even told us that there's, at the WHO's advice, they've now started observing social distancing protocols, wearing masks on board the vessel, also making sure that they're sanitizing, saying really that they're trying to get on and keep their hopes up as much as possible, because there's days ahead of waiting before they can even get off the vessel itself. So for a lot of people, really, it's just been a difficult time of trying to make do with the situation as it unfolds.
Yeah, Pumsa, just take us through what we expect the procedure to be. The ship is eventually going to start moving again and make its way to the Canary Islands. And what happens then?
Certainly, what the cruise line owners, Oceans Expedition, have told us is that one of the things they're waiting for now is specialized aircrafts that are going to be arriving in Cape Verde that will then evacuate those ill passengers. They will then be taken to the Netherlands, where they will receive that much-needed care. Once that happens, they will then set sail. They're hoping to either go to Gran Canaria Island or Tenerife, which will be about 3 days of sailing. At that point, they're hoping to also then continue health checking protocols to make sure that no further passengers are showing up with symptoms, but also that more is done to get clarity on the strain of hantavirus that has been that's attacked the passengers, some passengers on that ship. So it's days really of waiting, but also then once they do arrive, it's not going to be a simple matter of getting off the ship. Certain health protocols need to be observed once they do arrive on land there.